Thank you for joining our information session today to learn more about the Psychiatric Mental Health Certificate Program here at the Betty Irene Moore School of Nursing. My name is Stephanie, and I am a part of the admissions team here at the School of Nursing. For the next hour or so, you'll be hearing from my other colleague today who will highlight a bit more about the certificate program and what it entails, along with our requirements, and we'll also go over the overall admissions process. So I'll go ahead and pass it over to our other special guest so that she can introduce herself.
Thank you. Thank you so much, Stephanie. And thank you to all those in the virtual world for joining in on a Tuesday evening. I know work is pretty much a long day and you all can choose to do so many other things, but I do want to make sure you get all the information you need in order to make a decision related to whether this is a good fit for you. And most likely, I think this is also a space for you to ask questions to really make that determination. As you can see in the photo here, we actually have our program director, Linda Creighton Wong. She's not able to join us at this time, but I do want to give her credit that she has a background as a psychiatric nurse practitioner and a psychiatric clinical nurse specialist. So we are specifically working with the UC multi-campus program for the Postmaster's Psychiatric Nurse Practitioner Certificate Program. I just want to really emphasize that because I know sometimes the question is whether or not they have to be a practicing APRN, which I think in the FAQs we'll probably see the response to that as well. And then Linda Creighton-Wong has a background in adolescent and community health treatment and has been teaching for the past 16 years. She has worked in psych for the majority or her whole nursing career, and it has been a rewarding experience. My name is Vandy Loth. I am also a current practicing psychiatric mental health nurse practitioner. I'm located down in the Bay Area for those who are familiar with the California geography. Shout out to anybody else in San Francisco and go Giants, but also appreciation for all the other teams across California. I primarily work with refugees and have been teaching for about 3 to 4 years. I enjoy it. I like my heart really goes out to students because you all are um, eventually our colleagues once we are out in practice. So I'm looking forward to that. All right, next slide. So the purpose of today's session is primarily to talk about this postgraduate certificate program. So let's start with the program goals. Why did we start this program? There are many reasons, and some of the main goals were to expand the psychiatric mental health nurse practitioner workforce across California. As you likely know, there is a huge workforce shortage and prolonged delays for individuals accessing care. So we want to fill in the gap with the state's mental health system by increasing the number of available providers to see patients. An absolute priority and part of our mission is to recruit students from underserved rural and urban communities. There aren't enough providers in some areas, and in some regions, there aren't any for many miles, leaving individuals without access to care. We want folks to stay in the communities they train in. You all know the communities you live in best, and we have a vision for individuals staying in their communities and serving those they know. With a grant from HCI, the Department of Healthcare Access and Information, we have been able to accomplish this mission. All right, next slide. All right, let's talk about the psych NP specialty. There are many differences across NP specialties, and I'm very passionate about the specialty that we're pursuing or offering to you all. And with the aim to transform psychiatric nursing care through education, clinical practice, and research, there are a priority in our program and for our faculty. We also value empowering students, clinicians, and our communities to provide public service focusing on promoting diversity and health equity. We also advocate for advanced psychiatric nurse leadership at local, national, and global levels. In addition, as most of you know, psychiatric patients show up in all practices, and being able to meet their mental health needs allows for more holistic care. Given the workforce shortage, there are also many job opportunities, and PMHNP salaries are often higher, which allows the certificate to pay for itself. Based on a salary increase, you will likely pay your certificate within first 2 years of being a PMHNP. Thank you. Next slide. So why choose the UC PMHNP certificate program? As we mentioned, all patients have mental health needs, and being able to treat the whole person allows for a depth and breadth of patient care that is holistic, individualized, and culturally appropriate. UC has a strong national and international reputation as an educational and research leader. Our program has many resources available for students, including a clinical placement team, student services team, a wellness team, and excellent clinical and didactic faculty with a wide range of strengths. Also, our faculty are very hands-on and dedicated to your success. Often in online programs, students can feel isolated and disconnected. Our students report that they appreciate the time and attention they receive from all the faculty in the program. We care about each student as an individual, so you don't get lost in the large system. Another benefit of our program is that you don't need to find your own preceptors. Our clinical placement team assists you with that. I do want to pause there a little bit. So if you are doing some comparison with other programs, many, especially the online ones from out of state, have you be the required party to identify a preceptor to secure. We definitely work closely with you to try your best to locate you with where you're at and work through our connections to see if agreements are possible in some of the local clinics that are nearest to you. With that being said, sometimes students are commuting or having to travel about an hour and a half, which is also not out of the norm in terms of comparison to some of the other specialties that we have. And the main goal is just finding opportunities to be able to gain the skills and essentially have an opportunity to expand your competencies in obtaining your mental health nurse skills. All right, next slide. California is a large state. Many of you are living in it and may be familiar that the nice part is that our multi-campus collaboration is separated into 4 specific regions. We have the UCSF San Francisco Bay Area to the north, UCLA, UC Irvine in the southern region, and UC Davis to the east. Faculty and staff at each campus work synergistically to connect with students, sites, preceptors, and large communities. UC Davis is the administrative house for the program. However, it is still a multi-campus collaboration with faculty at each campus, knowing their community and the sites they're at. Next slide. Right. UC Davis is the program's new administrative house. So we do have accreditation from the BRN and CCNE. One of the other biggest feature that I really want to highlight is our faculty members. So this is actually one of my favorite slides. The faculty members are representative across the state and have many different specialties. We have folks in psych emergency services, psychedelic medicine, and researching and practicing a variety of different areas. So you have a wealth of expertise, individuals who are passionate about what they do, love to talk to students about their passions, and are excited about teaching the content. It is one of the most valuable pieces of our program. So the other piece that I want to highlight here is that we work pretty much really well as a team. So it's not like you're speaking to one class with one professor and they're not familiar with what's happening in another class. We really try to ensure that we're collaborating and are in alignment in terms of the different content that we would like to cover to make sure it's synergistic. And I think we've got a good curriculum in place. So The other piece that I would encourage you to do is actually go ahead and Google a few of those names. A quick shout out is Andrew Penn is your pharmacology or future pharmacology instructor, and he's actually very well known amongst the psychedelic research, and you may see him featured in a lot of the big talks as well. And all our other instructors have great leadership skills as well as expertise and experience in the field. So whenever you have downtime, feel free to look us up. Okay, next slide. Here you will see the curriculum. Our core classes include one psychopathology course, a foundation of a spectrum of diagnoses and symptoms you will see in practice, three psychopharmacology courses, and three psychotherapy courses. The great thing about these is that they build in complexity. They start with foundational principles and end in the final quarter with psychopharm and psychotherapies discussing complex cases and how you would approach them holistically, using both skill sets you are learning. Then you will see the PMHNP role development course, an exciting immersion course where you will be with your Psych NP faculty and colleagues, taking the didactic content and applying it. It is a workshop-based simulation where you practice these skills in real time. Then you will have your longitudinal clinical residency, where you are in clinic essentially every week. Minimum 2 days out of the week is what we're asking, practicing with the clients and gaining the need and experience for future practice. I will highlight that all these classes essentially clustered together is really focused on developing your clinical skills and knowledge base to be able to practice once you do graduate. One of the best feedback that I heard from the cohort that just recently graduated from last year felt very, very confident in going out into the workforce, and they felt that the program really prepared them. So I usually think you get what you put in, and a lot of it is adult learning, but we really whittled it down to the core main key components of all the things that you would need to be successful once you take off or once you graduate. And so in comparison to some of your how do we say your degree granting programs where you felt like, oh, why am I taking these courses? It's a lot of additional side courses and busy work, but essentially all these are really focused on what you can apply into practice. Okay, so the question comes up is how much time is live classes versus studying and prepping? Typically, the immersions are 3 days each during 3 quarters, summer, fall, winter, and these 3 days are usually on Thursday, Fridays, and Saturdays. Those will be live via Zoom or in person. You'll get notifications of the dates to be able to prepare and block off in advance, but we will let you know beforehand to set aside those times for the synchronous sessions. Then there are weekly clinical residency case conference, which is an excellent part of the program where you get to spend time with your smaller groups every week with a faculty member. And this is where fellow students are able to discuss clinical cases and how you're progressing in your skills and role and talk about the complex things that are coming up. And you have group supervision and faculty supervision about how things are going in your clinical site. And then speaking of clinical, you do have 2 days a week of clinical training minimum. Some may be asked to do more, depending on how you're accumulating and accruing your hours. This is typically usually during Monday through Friday, which is a great representation of existing clinics that they usually work Monday through Friday, daytime hours. There may be some times where there are evening or weekend opportunities, but those may be supplemental rotations to get your hours, and there's not a robust amount of those that I have seen. And there are also times where you'd be live or in person for the majority of our clinical experience is actually live and in person with your clinic site. Okay. I know there's some questions that are coming through. We'll definitely get to those as once we get through the content here. And believe me, we're halfway through. Okay, next slide. So this is actually one of the best features of the curriculum that we have. I think in addition to the classes that we're taking, if we're following the wheel, starting with the orange and going clockwork wise, um, our emphasis with our curriculum is really looking at these competencies in addition to those clinical hours. And a component of our competencies is this communication and collaboration. I know sometimes these terms are so loose and they're floating out there, but the communication piece actually refers to not only you and the patient, you and your clinical site, but it's actually you and your colleagues, peers, as well as our administrative team with the university. You work very, very closely with our clinical placement group, in addition to student services and the wellness team, that there's a wealth of support that's coming your way. And ideally, we hope that there's that communication and collaboration taking place between you and the faculty as well as the staff. Going down to the blue section, self-reflective practice. This, I will say, will push you to exploring a more deeper understanding or self-reflection in terms of what's coming up for you in some of these sessions and how they're impacting client care. So the self-reflective practice goes beyond journaling. I think many of us have been through our RN programs where there's weekly journals. This is taking place in those small clinical case conference sessions that you're doing. So each week, essentially it's Wednesdays, and I'll let you know in advance that we do ask that you block off your Wednesdays specifically for these weekly courses. So class in small groups of about 8 students with one faculty, you create a little bit of a home base to be able to reflect on the encounters that took place with your clinic that week. As usually there's some discussions related to ethics, some discussions related to role transitions, but as it's a good opportunity to recognize where we can grow and where we can improve. The structural awareness is a component that we weave through that we essentially are working within systems. And you can see that our foundation is really hoping to serve the community. Like we're trying to fill in a gap with ensuring that we provide more access to care for patients. And a big factor in impacting that is the structural component that exists. And I really, really like that we take in this comprehensive view of a patient case to look at them more than just their medical condition or mental health condition, but essentially the systems and the structures in place that may be contributing or impacting their wellness. So we follow a biopsychosocial structural framework that looks into um, all aspects of care. And I think in terms of case conceptualization, it helps us weave in our treatment plan a lot more comprehensive and a lot more human. So I think this really leans into taking in patients as a whole, but as people and being able to build that connection. Which lastly all accumulates into this PMHNP role development. We'll be looking at cases from a different lens. Many of you are coming in with so much experience already, and I it's not for a waste. I think what essentially is happening is you're building on those skills and incorporating and adding this psych mental health lens. And to do that, it requires essentially the whole other components here with communication, self-reflection, and structural awareness. So this is the model we are following. Hopefully it aligns with your values, but we always loop back to this. Thank you for letting me take a few minutes to highlight this. I know that was a little bit lengthy, but it's important. Uh, Next slide. Perfect. So the curriculum is essentially what we highlighted earlier. Sometimes it's just nice to hear and see the same information in a different form. These are the courses that you will be taking. Again, I know that sometimes it feels confusing of what is synchronous and what is asynchronous. So the majority of your classes are essentially modules that are due weekly. So it does keep you on in pace and aligned with the typical schedule. I think sometimes there's confusion with online course content where some folks may be able to think that they can cover all the classes at the end, the last week of school, but they do have some weekly quizzes and some weekly assignments to turn in. And this is really to make sure that you have some of the foundation when you do enter the clinical setting. So there's a purpose and a reason for those weekly modules. The main courses that you will meet synchronously are those immersion courses, which we highlighted are those skill building courses. This includes simulation as well as guest speakers that'll help you practice some of the things we want to emphasize, whether it's different therapy techniques or different reflective practices, but usually a lot of great content and opportunities to grow and interact with your fellow colleagues. A weekly clinical conference are the smaller groups where you are broken up into teams of 8, and essentially you have the opportunity to be able to build a relationship with those team members to um, I hate to say it, sometimes others around you may not be able to understand the experience you're going through with coming back to school, but your peers and your classmates will. And so that's why the weekly clinical conference is a great support network to be able to check in each week on how we're doing. And then lastly, the synchronous sessions are those 2 days of clinical trainings minimum. Some folks may have to do 3 days or 4 days, depending on their progress with their clinical hours. Okay, thank you, Stephanie. Next slide. And this is a great summary in terms of how clinical works, because I know that that's usually the scary big part of going back to school. So our program is about 11 to 12 months long. We start from July, ending in June. And if things turn out smoothly, many folks will be able to start clinical right when they start the program. Or you'll get connected and have the onboarding process in place. The goal is to be able to hit the ground running where you start training essentially in your 2 days of clinical sites. The faculty and staff are managing your clinical placements, and this is because a memorandum of agreement or MOA, MOU, memorandum of understanding, a contract has to essentially be in place between the clinical site and the university. And that's where some of the delays may happen, where some folks might not be able to start their clinical right at the start of school. It may take a couple of weeks to a couple of months. And this is just to ensure that there's safety in place and that the arrangements align with the needs of the students. And this is reflecting back that there are some sites that may misunderstand or have different arrangements in place for students, and we just want to make sure that you're getting your learning needs met. So many of you will have a primary placement, meaning longitudinal, where you get to stay with the clinic site for 6 months to 9 months to the whole program year. And usually through that timeline is where you see most of the growth as you start off. And then in addition to the primary placement, you may get an additional specialty placement, and this is to cover some of the modalities that you'll need for the board exams. So in order to sit for the ANCC boards, national boards, you will have to have individual therapy, group therapy, pediatric hours, as well as your standard medication management hours. So sometimes a clinical site might not be able to accommodate all types of those modalities. And so we do have to have you connected with additional placements. Also, sometimes you have an interest where if you want to work with substance use, you want to work with foster youth, or you want to work with maternal mental health. Sometimes when those opportunities open up, you'll be able to do like 1/4, 2/4 rotation with those additional sites to get that exposure. Okay, next slide. All right, this is probably a whole lot of numbers to sort through. Clinical hours. The expectation for a sitting for the ANCC boards is 500 hours, but our UC Davis guidelines and current standards is that students need to complete 540 hours. Many students actually complete a lot more than this. Some last year have reached 600, 700 hours. These are training times where you have the opportunity to work with a mentor and a preceptor. So we do encourage you to really take advantage of the opportunities that come. Uh, we can't guarantee that you'll receive a job after it, but I think if you showcase yourself really well, we had some situations in the past with like about 3 or 4 students who were able to secure positions at the site that they precepted at due to their willingness and their performance and their ability to really connect with the preceptor. So 540 hours might not be a bad thing if it means that you're uh, on the good side of your preceptor as well. So we just really, really want to highlight there. We're aware that 500 is listed in the ANCC, but again, in order to graduate and receive your certificate, um, in the we currently have a process to ensure that you have 540. Competency per UC School of Nursing. This is really just to highlight that we are not just hours based, it's both meeting competencies, getting checked off on your skills through those simulations to ensure that it's both the hours and the competencies are met. We wouldn't want you to have 500 hours of shadowing experience because that's not really developing your skills. And again, we are encouraging ensuring that you have placements to allow you to have exposure to both pediatrics and adults in order to represent the across the lifespan training. When I was talking about the 2 psychotherapy modalities, where we're shifting to that bottom row, the minimum is 2 psychotherapy clinical opportunities, and this includes individual therapy and group therapy. That's where you meet the 2 modalities, meaning you will facilitate, practice your therapy skills, and work with both individuals and groups. And then specialty areas for those supplemental rotations can be in some opportunities that may come up in your location. There's no guarantee since all locations vary in terms of the robustness of clinical sites. And so for some folks, lucky folks, you may be able to have a pick at addiction, perinatal mood disorders, consult liaison. How do we know whether you want these sites? Once accepted, you will receive a survey from our clinical placement team inquiring about the different zip code areas you're able to commute to, as well as the different interests that you have, whether it's inpatient, outpatient, residential, and so on. So placements are within the student's geographic area, meaning we won't have someone from LA have to travel and commute all the way to San Francisco. That's not realistic, and we wouldn't put you through that. I will say in the in-person campus rotation prior to the pandemic, we did have LA students travel for classes all the way in San Francisco back when San Francisco was hosting the program. And she was a postmaster's too, but morning day she would fly in, and then after class in the evening she would fly out. And we are not expecting that from you. So I hope that also helps shed some light onto what students are able and willing to do. Thank you, Stephanie. Next slide. All right, clinical placements. So like I mentioned, right when the program starts, we start in the summer, July, continuing through June. You'll be expected to be in clinic. So some students ask if they can cluster all their clinics in the first 6 months and do like 40 to 80 hours a week. That's not really where growth happens. Growth really happens through that longitudinal skills building and being able to see your clients multiple times across the year. So we do not encourage ending clinic early. We do expect you to be in clinic all throughout the program. So I think in terms of folks trying to plan, they were hoping that they can cluster all their hours at the beginning of the year and then not have clinicals during the last quarter, but it doesn't work that way. Students do complete at a minimum at least 2 days per week of in-person clinical work. So this averages at about 16 hours. Some folks are able to get 12-hour days and do 2 days of 12-hour days, which is about 24 hours. Again, just highlighting and emphasizing 540 hours are required to graduate from the program. If we look at 540 hours over the span of 10 to 11 months, that's where we gathered that 16 hours keeps you on track to meet that goal. Students are assigned a clinical rotation, and we must have a training affiliation agreement. This is that memorandum of agreement in place, and these are legal contracts with the clinical rotation site as well as the university. So some background and logistics. Again, this is all in place just so that you can make an informed decision of what realistically fits into your schedule. I know some folks have a true passion in really wanting to pursue this and it has been on their mind, but if you're not in a position to decrease your work hours in order to accommodate the clinical schedule, it's difficult to see what may be possible. So on average, we do recommend to participate in the clinical aspect and the course aspect. We recommend no more than 20 hours of work if you do plan to continue to work part-time and pursue the program. This is really just to manage your own wellness and really role model that balance of life because we want you to be able to absorb the content, fully engage with your clinical preceptor, and really just give yourself this gift of engaging with the education program. All right, next slide. Okay, what do you bring? This is us really acknowledging that you bring a lot. As students, what do you bring to the program? Uh, One great thing about teaching postgraduate nurses is that you all come with various backgrounds. You all have tremendous qualities to offer our program. Your strength is in your experience that you have from your prior graduate programs, your lived experience, as well as what you've learned so far in your career, the skills and your personal stories that had led you to this point at this time. You offer a lot to your fellow learners. I will say students probably hear and learn from each other the majority of the time because a lot of our case conference is group discussions. Where can you grow? Growth can be challenging and uncomfortable. You may have certain expectations of how things will go or be, so flexibility is probably the most vital in maneuvering through those challenges, and it may arise outside of your control. You want to cultivate curiosity and keep an open mind, being open to feedback on ways that you could improve. This You will get feedback from your faculty, your preceptor, your didactic instructors about your self-reflection and your writing and how things are going in your courses. You want to become self-reflective of how do I feel during these interactions? What is going on for me? Understanding yourself is critical in not allowing our implicit bias, which we all have, to get in the way of our patient care. This is essential and will be discussed more in small groups. So again, I do want to highlight here that you're starting, you all have some degree of experience, so it might take a little bit of an adjustment to be that new novice nurse in this new set of skills that you'll be pursuing. But I think you're in a really supportive environment to be able to help you stretch and grow within that space. Now I think we'll go ahead and pass it down to the admissions team for you to hear some of the logistics with Stephanie.
Yeah, thank you, Andy, for the great insight on the program. I know our applicants, are very interested in learning more about what they can expect. So that was all great. Alrighty, so we'll go ahead and switch gears now and talk about the admissions requirements and the process for applying to the program. So as far as qualifications, we are going to look for the following items. Applicants must have a master's degree, a master's of science in nursing degree, or a doctorate of nursing practice, DMP degree, current unencumbered RN license and a PRN license within the state of California. You must have both the degree and your license at the time that you submit your application. You also must reside in California for the duration of the program. And lastly, it is highly, highly recommended that your prerequisite courses are completed before the program, just because it'll give you a good foundation for moving forward in the program, as well as, and it's one less thing that you have to worry about. And I will talk about those prerequisites in a couple of slides. But who can apply? This program is catered to nurse practitioners, clinical nurse specialists, certified nurse midwives, and certified registered nurse anesthetists. As far as the prerequisites go, all prerequisites again are highly encouraged to be completed before you start the program or at the time of application. And they all must be completed at a college level from an accredited institution and must be included on your official transcripts. Each prerequisite is expected to be one full course, either a quarter or a semester, and all prerequisites must be completed with a letter grade of C or higher. Prior coursework in the following areas is required by the American Nurses Credentialing Center in order to be eligible for the PMHMP board certification exam. And you can visit the ANCC website for more information if you do want to look more into that. So with that being said, you must have 3 separate comprehensive graduate level courses in the following. So advanced physiology, pathophysiology, including general principles that apply across the lifespan. And I really want to emphasize that these courses really do need to um, explain that they are across the lifespan. Super important. We'll also look for advanced health assessment, which includes assessment of all human systems, advanced assessment techniques, concepts, and approaches. Advanced pharmacology, which includes pharmacodynamics, pharmacokinetics, and pharmacotherapeutics, all broad categories of agents. In addition, applicants must have completed content in health promotion slash disease prevention, differential diagnosis slash disease management. Vandy, did you want to add anything else to the prereqs?
I know that if you haven't done so already, sometimes those pesky syllabus are really difficult to get a hold of, but it'll save you a lot of time later. So I know we were just highlighting those 3 Ps, the physiology or physiology, pathophysiology, physical assessment, pharmacology. I know sometimes it goes by health assessment, but sometimes when I say 3 Ps, I feel like it's missing the P. This is really just for you to be able to sit for the boards. It's as much as I wish I can give clearance for a lot of these things, it's really the ANCC that comes back with requesting for those transcripts and syllabus. So um, I highly, highly encourage you to have those ready when you do apply for the program. Thank you,
Yeah,
Stephanie.
of course, and thank you for bringing that up. I wanted to emphasize, especially since I think it was originally noted differently on the application, but it's all fixed now. So your syllabi are, if you are admitted into the program, your syllabi are going to be required. So it is highly encouraged that you start to locate those and get them ready. If you have them, include them in your application, and that's one less thing you have to worry about later. If for whatever reason you don't have them at the time of application, again, it's okay. You can still submit your application and you'll be reviewed. But if you are admitted, that is going to be something that we are going to need. So it's just good to start locating those documents in advance. Perfect. So I'll go ahead and move forward to our application requirements. In order to qualify to apply, you must have the following for your application: So like I mentioned earlier, you must have a current unencumbered APRN license within the state of California. You are going to also submit all of your official transcripts from all post-secondary institutions that you've attended. And I want to emphasize that this is all post-secondary institutions that you may have completed courses with, even if it was just one course that you think has nothing to do with the program. The Nursing Cast website is still going to require that you submit all of those official transcripts in order for your application to be verified. There are also going to be 4 short essays or essay questions that you will respond to within the application. And I will dive a little bit deeper into what you can go into in a couple of slides. You'll be submitting 3 letters of recommendation. And again, I will explain more in a couple of slides. You will submit a resume or CV. And then all materials must be submitted to Nursing Cast by the November 1st deadline. And this is by 11:59 p.m. Eastern Standard Time. I really want to emphasize that it's Eastern Standard Time, just because we are not on the Eastern side. So keep that in mind when you're submitting your application. Don't wait till the last minute. But diving into the application process, like I mentioned a little bit earlier, you'll be submitting it through Nursing Cast. Our applications have already opened actually, so you can go in today and start working on that if you want to. And it will save your progress as you go. And then again, as long as you submit it before 11:59 on November 1st and you meet all the qualifications, you will be reviewed and then you'll receive next steps from there. Um, in December, a select pool of applicants will be invited to submit a secondary application via our UC Davis Graduate Studies. And again, more information will come to you at that time if you are chosen to move forward. And this is just something that all of our graduate programs need to do. It's a secondary application, again, through the Graduate Studies Department. From there, space available review may be available from November 2nd until May, but that will be determined after that initial pool of applicants is reviewed. So to recap, for our admissions timelines, again, our applications are now open and that priority deadline is going to be Saturday, November 1st at 11:59 p.m. Eastern Standard Time. From there, the space available deadline will be November 2nd through May 15th. Decisions will be determined by February 2026, and then the summer quarter begins in late June. And then official notifications will be sent to you directly from the UC Davis Graduate Studies, but you'll receive more details regarding that as you move forward in the admissions process. So now let's go ahead and talk a little bit about tuition and funding support. I really just want to start by saying and emphasizing that I am by no means an expert when it comes to the fees and financial resources. We actually have an incredible financial aid department and team, so I'm going to highly encourage you all to reach out to them directly if you do have any questions regarding fees and aid and different resources that may be available to you. But with that being said, as a general overview, the PMHMP program tuition cost is just over $45,000. And as we all know, education is an investment. And so if you look off to the right, you'll see a detailed image of what you will receive with your investment in this program. Being in a UC-led program, you have the benefit of getting the best faculty from the top-rated UC nursing schools, faculty from UCLA, UC Irvine, UCSF, and of course UC Davis. With clinical placements, we are committed to serve the community where you live, and we also have a clinical coordination team who will find your placement. If you have somewhere where you'd like to complete your placements, then that's great. You can always let our clinical coordination team know, and they'll work with you to try to get those arranged. But if you don't have anywhere that you'd like to complete the placements at, that's not something that you have to worry about. Our team will ensure that you are placed. You also have access to many UC resources across the UC system. And lastly, student support. So each student receives a UC Davis graduate advisor to help them navigate the program. And also, students work with our clinical faculty liaison to ensure that they complete their required clinical hours. They provide mentorship to you, and just general feedback and support throughout the entire program. Additionally, like I mentioned, you have access to the amazing faculty that will additionally provide support and mentorship as needed. Hey, like I mentioned earlier, I'm not an expert when it comes to financial aid, but this slide has a few resources that we encourage you to look into. Um, Again, please reach out to our financial aid department in addition to looking at these resources, just in case there are any other resources that may be available to you or any other information that might not be provided on this slide. And then, like I mentioned earlier, this session is going to be recorded, so you'll be able to look back on this information if you do need to do so. Alrighty, so I'm sure after listening to all of that information from us, we have a few questions that may have popped up. I'm going to go ahead and open up our Q&A chat now. If everyone could just give me one quick moment. Um, while we're at it, I do have some frequently asked questions up on the screen for you. Again, you'll be able to access this recording once our information session is over and it is sent to you. But let me go ahead and look through some of these questions. So our application process does not require an interview. Great question.
We can bounce off each other too,
Yeah, go
Stephanie. I
ahead.
think the next question is, if you find the preceptors for us, can we request within 20 miles? This one is really, really dependent on your area and what is available, and you'll be working much more closely with your clinical placement team and working through what accommodation needs are that we should be aware of. But essentially, uh, if you're in like San Francisco, there's plenty of clinical sites, and so it's a little bit easier to be within 20 miles. If you're in San Luis Obispo or San Diego, it's a little bit of a bigger distance in terms of finding a an appropriate preceptor that would fit sort of our requirements and what our needs are. And because what we want to do is we want to pair you with a preceptor who is interested in wanting to teach a student. We've heard about other schools and other sites that charge students for clinical hours, and they charge up to like $5,000 just to have unsupervised group hours, which is not the best for your learning needs. And we're not here to have you just go through and have a checkbox off your clinical hours, but we really want you to be able to make connections with your preceptors and really have a robust learning opportunity. So I know that question is probably not a nice answer to receive, but it really just depends on your region and your area and how robust the clinical sites are in that specific area. Okay, and then just to clarify, 3 days per week, that's on me. So for sure, minimum 2 days of clinical per week, and the majority of clinical sites are Monday through Friday. So we do ask that you dedicate 2 days out of the week for clinicals. Wednesday is for your weekly group meetup, and this is for your small group with 8 students and per group. The meetup for your clinical case conference is really just 2 hours out of the day on the Wednesday. And so some groups on the Wednesday meet in the morning. If you're placed in the afternoon group or the evening group, we just want to make sure you have that clear to be able to attend the class that you're assigned to. And the goal is that we were able to cluster you with other peers that are nearby, just in case you want to be able to study in person together or meet up and coordinate for some of the assignments and connect you all to each other. So again, Wednesdays, there's varying classes, but each of the Wednesday small groups are 2 hours, and you just get assigned to one. The 3 days per week is actually your immersion, which is 3 days out of the quarter. So it's not the whole, you don't meet each time, but it's consolidated immersive experience where they bring the whole cohort together on Zoom to be able to go through some of the skill building and didactic content with a live lecture as opposed to asynchronous modules that you're doing at your own pace. So you'll have a live guest speaker. Usually it's a series of different speakers allocated time during the day or over the span of the 2 to 3 days. So again, hopefully, Margaret, that answers your question. We give you the dates in advance of what to block off for that specific quarter. Essentially, for those who do get accepted, you get a list of all the dates of when the immersion is at the start of the program. That way you can have full awareness of when to request time off from school, or not from school, from work. Do we have to go to the clinical placement that we are assigned? What if we have a site that you prefer and have a connection? Lindsay, perfect. This is a great question. You get to work closely with your clinical placement team. So if you have a contact or a specific site that you already are aware that you would love to be able to work in or connect with, just give them the contact information so they can get started on that affiliation agreement. So the challenge is sometimes some sites won't sign off on the affiliation agreement, whether the lawyers on one end or the other have specific red tape in certain areas. So as long as an affiliation agreement can get started with our clinical placement team, we welcome any leads or contact information of because if you already have some connection with them, usually they're more likely to be able to be interested in taking on students. So yes, the clinical placement team will be happy to make connections if you want to give them some suggestions. So UC San Diego, if they have clinical placement sites, they're not currently associated with our consortium, but we have made efforts to talk to them. It won't be anytime soon, but I will just say UC San Diego has their own fellowship and own program, but no nursing school, so it makes it a little bit difficult. Do you mean a total of 9 3-day immersions on campus? So the campus, no in-campus immersion days are virtual. I don't know if I mixed up something with the 9, but 3 days per quarter for the first 3 quarters. You don't have immersion on the last quarter. And I hope that was that question. So the clinical rotation placements will be by the UC. So UC Davis clinical placement team will be in charge of monitoring, tracking, and connecting you to your clinical sites. Yes. And it's in collaboration with you. So your feedback and your information will definitely help. So the school initiates the affiliation agreement, but you can connect with the clinical placement team to get that started. And they'll be able to provide you with a lot of information. Once you get accepted, there is a whole orientation and onboarding, and you'll be able to meet the members of the clinical placement team as well as the social as well as the student support services and all the other slew of helpers. I think Stephanie is with the admissions team and will probably be a big key component in helping you through the admissions process as you get handed off to the student support team. Okay. No, great question. Keep it coming. I'm glad we have time for this. And then Stephanie, let me know if you need to cut me off. Is it possible to cluster clinical days to do more 1 week during a month or quarter? For context, I currently work 6 24-hour shifts per month in the hospital, usually 2 2 a week with a full week of every a month? Could I structure clinical to do 1 day a week or clinical for weeks when I'm working in additional hours on my week off? Leah, I will say it really depends on your arrangement with your preceptor and the clinical site that you're in. So the difficult part is sometimes preceptors have multiple students on different days. And so if they have that flexibility, it's great. I know when I had students, I had the flexibility at my clinic site to ramp up or ramp down as needed, but I think it just really depends on who you're connected with and being able to express that. I will say one of our current students does per diem work and travel work. So 1 week out of the month, she has to take off out of the state or out of the area. And she's able to make that arrangement with her current preceptors to be able to ramp up or increase her hours to accommodate that missed days. For the 3Ps, do they need to be within a certain number of years? There's no specific like expiration date that's set in place, but the ANCC really do look at whether or not it is across the lifespan, and if it's a reflection of across the lifespan, if they have some suspicion that it's not up to date in terms of the content, then they'll probably ask you for more justification or supporting evidence to demonstrate that it is across the lifespan and covers the content that they want you to cover. I will say, for the most part, I think curriculum has like one pivotal year that um, made major changes, I think is 2008. So if it's been a while since you've been in school, and you don't want to run into a hassle with ANCC, and you feel like you're before 2008, I don't think it hurts to retake like a 5-week course on pathophysiology or pharmacology. A letter of recs within 2 years, can it be from my academic professor more than 2 years ago?
I can go ahead and
Oh,
answer
good,
that, Vandy.
perfect. Thank you.
Yeah. And also I just want to be mindful, our session does end today at 6:30. So any questions that we do not answer, I know that there's still quite a couple in the chat. Please take note of that email that is posted on the PowerPoint and send us your emails with your questions. We are happy to help. Um, and yeah, we'll go from there. But basically, to answer the question about the letters of rec, um, we encourage that they be recent because these individuals may know you the best up to present day. However, let's say that you don't have a recent individual who you can request a letter of recommendation from. You can definitely go back to that professor or whoever it may be. Just ensure that they are really able to speak on your abilities and your expertise to be a future student and a future PMHMP. And then I want to answer just one more question before we get going here regarding the short essay questions. These are really for you to express to our admissions committee why you want to be in this program, why you want to be a future PMHMP, and why, with UC Davis specifically. We or the admission committee is going to be able to see your transcripts, your grades, everything else with all of the other items in your application. So this is really where you get to present yourself to the best of your abilities for our admission committee to get to know you more. Again, at the end of the day, we just want to make sure that not only are you a good fit for us, but that we are also a good fit for you. But yeah, with that being said, I'm going to go ahead and wrap up the session today. Again, if you have any additional questions, if there's something that we didn't get to that you really want answered, please send us an email. We are happy to help you. And thank you, Vandy, for joining us today and for giving us all that great information. And we hope to see your application coming in before that November 1st deadline.
Yes, and this is not the only time that you can ask questions. As Stephanie probably dropped in the chat the contact information for the admissions team, and again, I think you'll be able to receive a follow-up. So I don't want those that have the lingering questions and excellent questions that are some that I haven't heard of yet. So I am glad they're very specific, and hopefully we can get those to you soon. I appreciate
Yeah.
your night with us. Yeah, thank you, Stephanie.
Thank you. Have a good day, everyone.